The world has made strides when it comes to HIV prevention and treatment. Kenya has also been keeping up with the world's development since the first case of HIV was reported in 1984. On this week's episode of Health Watch, we bring you up to speed with the HIV milestones. The HIV journey in Kenya started the day Dr. Joe Muriuki shocked the country on September 20th, 1987, when he revealed his HIV status.
Dr. Joe Muriuki succumbed to cancer. The cancer, they're calling it esophagus cancer. So that is cancer to do with the throat. So by the time of his passing, he was at stage 4A, and he fought a good fight. But you see, for him, it was just not cancer. It was cancer and underlying HIV. So the fact that he had 2 terminal illnesses, that kind of really contributed to the acceleration of to more like him coming to pass. Yeah, so the combination of the two diseases is what he succumbed to. You know, you only have one dad. You can only have one dad. So we've lost our dad. First of all, we've lost our father. We've lost the head of our family.
Joe was a father, has been a father to me since I joined his family. And being a girl who grew up without the presence of a dad, it was a beautiful experience getting to have that relation. It was nice. I never felt like I was not a blood daughter, you know. He was good to me. He has taught me so much. Even during his sickness, we've shared a lot. And he has helped me even get closer to God. Because of the way we had a lot of hope, he would sometimes come and you're even scared because of the way you find him. But he will encourage you. He had the willpower. He is a warrior. He's a fighter. And I feel it a loss. It's like, you know, I lost my dad, and now the one who had come into my life now is gone, you know. It is sad. And I will really miss him so much. Yeah.
You know, we've lost like our cover. Yeah, we've lost our mentor, we've lost our, you know, him being positive to us has made us more like people who can break the ice on HIV/AIDS. That we can sit right here and we start talking about HIV/AIDS and what HIV/AIDS entails, and even more of how to live with HIV. Because that has been the biggest campaign for our dad. It has been how to live with HIV. That also taught us how not to get HIV.
The doctor who diagnosed him with the disease informed him that he only had about 3 months to live. He was 28 years at the time, and he ended up living more than 30 years with the virus.
He taught me to love everybody. He loved people. His heart was always overflowing with love for whoever, you know. And he was a giver. You come to him, you will live a different person. If you come to him and you're down, you will live, your spirits are lifted. Yeah, he will not hold back anything that he is able to do. He will not hold back and say no. He will just help you. Yeah, he's a good person. He is an awesome man.
For Joe as a Kenyan to come up and say yes, it is true, HIV is in Kenya, and me as a person, I'm living with HIV was really important, because that was a wake-up call. That is the first time people even started checking, you mean this thing is real? He gave HIV a human face, and he explained that the H in HIV means it is in human, and it does not exist in monkeys, in forests, or on laboratories. And that the impact of that is that people then said, okay, if this man is talking like this, he does not even have AIDS, then let us go and see if we have HIV. So some people started going for testing. So some were tested positive.
I was in Kenyatta with him, and I was just remembering last night how people he inspired would send me messages and tell me to read them to him so that he can fight on. Maybe hata hawezi ongea na wao, but they just give you the stories and what he did for them and how he caused them to see life in a different way, even if they had HIV and it looked like it was a death sentence. He gave them hopes.
The first case of HIV in the country was reported in 1984. Back then, tests were not done in Africa.
It is through the guidance of people like Joe and others that the government had a body that we used to call National AIDS Committee. Later on, that is what became NASCOP, and another branch for coordination became NAC. And it is during that time that the country now acknowledged, let us now have a structure at the national level, at the provincial level, and district level that can help coordinate and respond to HIV. Now, the second role of Joe in that task force and committee was to make sure that everywhere where you are having a structure or a platform to respond to HIV, there was a person living with HIV. And that is the principle of greater involvement of people living with HIV that NEFAC uses up to today.
Muriuki served at the HIV Tribunal as a representative of people living with HIV. He was a member of the regional task force that formulated the East African HIV and AIDS Management Act. NEFAC Executive Director Nelson Otoma says Muriuki had selflessly used his life as an example in fighting stigma. Kenya has made significant strides in the fight against HIV. In the year 1998, the late President Daniel Arap Moi declared AIDS a national disaster, and later President Mwai Kibaki declared total war on AIDS in 2002.
You see, when HIV came and even President Moi declared HIV a national disaster, we still did not have a government body coordinating HIV. We didn't have National AIDS Control Council, NAC, and we didn't have NASCOP. So the president then formed a task force on how to respond to HIV. Like today we have a task force for COVID. Joe was a member of that task force and representing people living with HIV.
The first specialist to attend to HIV patients was skin doctors, as skin cancer was a common opportunistic infection. This is the year also that human immunodeficiency virus, HIV, was discovered as the cause of AIDS.
Treatment came in, and that treatment that came in was a cocktail. It was a plate full of drugs, mostly antibiotics, that you take just to ward off opportunistic infection, but not to treat HIV. And when ARVs came and was put in Kenya free in public health facilities in 2004, of which Joe was again very instrumental alongside others, it was like we were having 3 pills. Today we are having 1 pill, dolutegravir, for those who are in first line, and even second line is improving, becoming safer, better, and well tolerated. So it means tomorrow will always be better. So even for people today who may be saying they are tired of swallowing each pill daily, maybe tomorrow we have one that you can take weekly. Maybe tomorrow we have an injection that you can be given for a month or for a year, and so on and so forth. So what we learn from Joe is that patience and resilience, that tomorrow will always be better.
These have helped reduce the prevalence rate of the disease from 6.04% in 2013 to 4.25% in 2021. HIV deaths have also reduced from 58,446 in 2013 to 19,486 in 2021. Approximately 1.5 million Kenyans are living with HIV, with 1.2 million of them being on antiretroviral treatment. The number of health facilities offering PrEP has steadily increased from 107 at initiation in 2017 to 1,376 in 2020. The global journey towards an HIV cure has been long and tedious, though there seems to be light at the end of the tunnel. In 1985, the USA Food and Drug Administration (FDA) licensed ELISA test to detect HIV antibodies. Then came the light in 1987 when the US Food and Drug Administration (FDA) approved the use of zidovudine, an antiretroviral medicine. In 1988, World Health Organization declared the first World AIDS Day to be observed every 1st of December. In 1998, the first large-scale human phase 3 trials of an HIV vaccine began. This is the same year that President Moi declared AIDS a national disaster. Later, President Kibaki declared total war on AIDS in 2002. In 2007, the doctors declared the first person ever to be cured of HIV after stem cell transplant. In 2012, PrEP, pre-exposure prophylaxis, was approved to be used by HIV-negative people. In 2016, Undetectable and Transmissible U2U campaign was launched. In 2021 January, the US Food and Drug Administration (FDA) approved Cabenova, the first injectable, which is a complete HIV treatment regimen that is administered once a month, offering the first alternative to the daily oral treatment regimen. In the same year, in December, FDA approved the first long-active HIV pre-exposure prophylaxis PrEP injectables to use in adults and adolescents only. The cabotegravir injectable suspension is injected into a patient once every 2 months, giving people living with HIV an alternative to daily oral pills. In 2021, University of Oxford launched phase 3 HIV vaccine trial, while Moderna announced plans to develop mRNA-based HIV vaccine. And in 2022, International AIDS Society announced that a third person, a woman living with HIV, was cured through a bone marrow transplant. Milestones are being made when it comes to HIV treatment, with the latest being use of vaginal rings and monthly injectables antiretrovirals. On the other hand, Kenya is working to ensure that 90% of its population know their status, 90% of those living with HIV are on medication, and 90% of those on medication are virally suppressed. Beldin Waliaula, KTN News.